How are you getting on? Skin improving a bit? Or not?
Nah, it's getting worse. And my arthritis is getting quite bad as well.
Okay.
My joints.
What I'm going to do is I'm going to try and get the girls who organise what we call patient services to try and see if they can push some of these appointments.
Yeah, no, that's
okay,
fine,
because
yeah.
I think, you know, it's obviously, you know, affecting you really badly at the moment, and we need to try and push them to try and get you in as soon as we can. So I think that's what we'll try and do there.
Okay.
Okay.
Ryan has a very severe case of psoriasis, probably the worst that I've personally ever seen. Linked with that, he also has a type of arthritis which is related to the psoriasis. Both of these conditions are caused by an autoimmune problem, so his own immune system is reacting against his skin in particular for the psoriasis and against the joints for his arthritis as well.
Which joints at the moment are being affected?
It's my knees, really.
Yeah?
Yeah.
Are they swelling a lot?
No, they're not inflamed or nothing. It's just really tight.
So it's just tight. Okay, can we have a quick look and see?
Yeah, my psoriasis on my leg's quite bad, though.
That's all right.
Let's see.
Dearie me, having a shocking time, aren't you? Wow. Wow.
Yeah.
That's terrible. Has it improved at all since you've been on the methotrexate?
No.
Because you were off it for a little while at one stage, were you, or not? Yeah. How long were you off it for?
Not that long.
No?
No. But it's really bad.
Yeah, I think you've proven your point to me. Are you using anything else at the moment just to moisturise?
When I get in a bath, I use my Cetrabend thing I've got.
Yeah. Okay, use that as a soap substitute.
Yeah.
Is that right? Okay.
Yeah.
Are you getting out in the sun and trying to, blast it like that?
Best thing I ever had, treatment-wise, was the sunbeds.
Yeah.
Cleared up straight away.
We've known for some time that people with psoriasis do better during the summer months when they have natural exposure to the sun. People who use sunbeds will often find that their psoriasis is helped as well, although there would be very few occasions when I would actively tell a patient to go and use a sunbed. In Ryan's case, I think that's a reasonable thing to do short term, particularly if he comes in to be seen and examined to make sure that there are no other issues associated with the sunbed use.
So that's just the Cetrabend, okay, which, you know, is a bigger amount, so it's about a litre of it. Okay, because you just need to try and moisturise that, I don't know, because your whole skin's flaking off. Do you need anything more from me?
Yes, I do, a sick note, if that's possible.
Yeah, I'm happy to do that. Okay, mate, that'll keep you going on that. Okay.
Yeah, okay.
I'll go and speak to the girls now and see what they can do.
Okay, that's fine.
No promises, but I mean, we've got to. They'll get back to you.
Yeah, don't sort that out, or...
Oh, don't worry about that. We'll sort it out.
Sorry about that.
Okay, mate. I'll see you later, yeah?
See you later.
Bye-bye.
Right then, hello, mister. How are you? Who's mum?
I'm Mum.
Your mum, OK. Do you want to sit on mum's knee?
Sit on my knee?
And then, are you
Nan.
Nan?
Nan.
Yeah, OK. Presume so, but you couldn't get that so wrong. OK, right then. And so this is Jonathan. Hello, Jonathan. How old are you?
4.
4? Quite a big boy, aren't you?
Yeah.
That's good. OK, so he's eating and drinking right. He's been to nursery.
No, I didn't take him today.
Right, OK. Who's drawn the pretty pictures around it? OK.
See if we've got any bigger.
Right then, let's just turn you round a bit, mate.
Because he seems to be more appearing up.
OK. Are they itchy?
No.
Are you scratching them? No, not at all. Don't they look itchy? I want to scratch them.
No. It's
Okay.
It concerns me.
Yeah. They've all got a central punctum. They've got one there. There's one there.
Yeah, they've all
Got it.
Yeah.
Yeah. OK. All right. You don't know what it is. Anybody else got it?
No, just him.
OK. New medicines or anything?
No.
OK.
He's took his calpol.
OK. I can't put a name on that. OK. It may be bites. Children do come in and see us with rashes all the time. Most rashes are completely harmless and will just get better by themselves, in fact. And he's quite all right.
Yeah.
Playing. OK. All right. Of course, every parent worries about the rash that can be caused by meningitis. Meningitis is a rare condition. Each GP would only see 1 or 2 cases in their career. Parents should worry if their child has a rash and the child is not very well. The rash of meningitis is red spots on the skin, and the important difference between meningitis and most other rashes is that the spots do not fade when you press on them. You can stick his top back on and just keep an eye on them, OK? Yeah. A well child is a well child. It'll probably just disappear by itself, OK? If it doesn't, or he gets worse, you bring him back. OK?
That's fine.
Is that all right?
Yeah, that's
Thank
fine.
you very
We won't
much.
put anything on. I'm surprised they're not itchy.
Yeah, that's what I said.
You know they don't itch. OK, bye-bye.
Louise Horton. Hi, Louise. Hello there. Do come on. OK, do come in. All right. I'm Dr. Cordell.
Hello.
You normally see Dr. Lee, don't you? Is that right? Yeah.
Yes. Yeah. I have like really sore skin, just hair on my breast. It looks almost like it's really dry skin. I spoke to someone, like 111 or whatever it is, and they asked if it hurt, and I said, I don't know, because I have no feeling along there after my breast reduction.
OK.
And it's getting bigger, so I'm obviously just a little...
The area of soreness is getting
so I'm a little bit
yeah.
concerned.
Well, we should check it out,
Yes.
shouldn't we? I'll have a look. OK.
OK.
Do you want a nurse to come in while I have a look?
No.
No?
As
OK.
I said to the receptionist,
Pop
once
up
you've...
behind the curtain here, then.
Lovely.
You just remove what you need to remove
OK.
to see the area. And you've not had rashes or sore patches there before?
No, I had a really bad infection after I had my breast reduction.
So, this is the patch?
Yes.
OK. The skin feels a little bit thickened, doesn't it, actually?
And it started off as big as my fingernail, and it's then just got bigger.
It's got
I would
bigger,
say maybe
and it's-
3 weeks.
Yeah, it's a bit
So
bigger than a penny, isn't it,
yeah.
now, really, in size? And it's got this sort of little bit off the side. Looks a bit like Australia, doesn't it? Dress yourself up. We'll have a chat about what to do about that. OK. Sometimes we take pictures of these funny rashes when we're not sure what they are, but I'll remember yours because it looks so much like Australia.
Well, I've never been there, so it's nice for Australia to come to me.
Yeah, it is, isn't it? OK, come round when you're ready and we'll chat about that. OK. So, first question, is that anything serious or sinister? It doesn't look like it. So I think that's most likely some form of dermatitis, OK?
Oh, OK.
It could just be a type of fungal infection. That's the other
That
possibility.
sounds beautiful.
Yeah. And if it's not one of those two, we will get a specialist assessment. Now, I think actually we will treat you for a fungal infection first, because if we treat for dermatitis and we're wrong and it's a fungal infection, we can make it worse. So I'm going to give you 2 weeks of antifungal cream.
OK.
OK, to use. At the end of that 2 weeks, if it hasn't gone away, I'd like you to go on to a steroid cream, which is what we use for dermatitis. OK, and do that for 2 weeks.
OK.
OK, if at the end of those 2 weeks it hasn't gone away, then we will get advice from a dermatologist, a skin specialist. OK?
Yeah.
OK, if we're not winning, it is important that we go on and get a specialist opinion. So, OK?
Yes.
There we go.
Lovely,
Jolly
thank
good.
you. Handbag and cardigan. There we go.
You got everything? Jolly good.
Yes, sir. Thank you.
OK. Bye-bye.
Bye.
Come in. Hiya.
Morning.
Hi.
Are you
Come
well?
and have a seat. I'm fine. Come and have a
Good.
seat. So, I'm Dr. Butterworth. What can I do for you? Right. OK.
I've run out of that stuff what I got
Right.
last time. It's helping, don't get me wrong. But it ain't getting the lumps away. Which is more or less around the middle
have
of
a
me,
look?
that's around the middle kind of thing. All the rest is like dandruff, but it's scaly, but
So it is quite thick,
it's not
isn't
getting
it?
rid of the lumps. I call them lumps, like, I don't know
Yeah.
what you call them, but... And I'm getting tending to pick them, you see, and I shouldn't do.
Are they really itchy?
Not really as such, no, it's just like a bad habit I've got now.
I think it's not just a bad habit, all right, because it is really thick and scaly there, so it's your psoriasis. Have you ever tried an oil, rubbing an oil into your hair to kind of
Don't like
loosen?
what you people have given me.
OK.
No, I'm getting old, never mind getting old.
Happens to all of us.
It does,
What to
love.
do.
I'm up in May next year.
How old are you going to be? Ooh, you're going to be 75
Yeah,
next
but,
year. 3/4 of a century.
Free television licence.
Right. There's a silver lining to every cloud. OK, so what I'd like to give you some, it's like a coconut oil
We've about 19 jars of that oil, coconut
Have you?
oil.
Okay. When you use it, how are you using the oil? What do you do?
Yeah. I just rub it in and then shampoo it off, love. I don't know.
Do you leave it on overnight?
No.
Maybe try leaving it on overnight, because what you need to do is get the oil to really soak into that really hard, dry scale. It's so thick, it needs time to soak through.
All
It's not
right then, my
working,
love. Yeah,
all right?
fried those.
Are you all right for your other creams, for your skin?
Yeah, A45 and all that, yeah. Or whatever else you've got. I don't know all of them. It's been that long since I've had it.
Whereabouts on your skin do you get the psoriasis? The
Oh,
bits?
that's on my legs, love. Not on my... That's on my legs.
Yeah,
But that's just born idle with me sometimes.
right.
You know what I mean?
Okay, so you need to
Well,
put
it's
your...
up to you, my love.
Well, you need to use your moisturiser.
Yeah, yeah.
How often are you using your
Oh,
moisturiser?
yeah, that's only when it starts scratching.
Okay,
Or
yeah.
itching, I should say.
Right.
And I shouldn't do. I know you should use it every day. I know,
You
love.
should,
I don't.
yeah.
I know, love.
You need a bit of a poke. Actually, there's another one called Sebco. Let's see if Sebco will work for you.
Cool.
Okay, so this is some more of the stuff for your scalp.
Yeah.
But I would use this, you need to use the coconut oil,
Oil at
leave
night
it
time.
in, massage it in really well, leave it overnight, and then wash it off in the morning.
Okay
And you
then,
can
my
use that in
sweet.
the
Yep,
morning.
fine, fine, those love.
All right,
Right,
take
thanks
care.
a lot,
All
no,
right,
thank you.
bye then.
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started.
That was the start of it,
The start.
yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
I mean, that's the
Showing here.
most terrible bruising I've ever seen.
And no other reason.
No, I don't remember.
falling,
I mean,
no
you know, I
injury, no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right.
Um,
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but
it...
it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking
Right.
it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly. Don't know what
Yes.
to say.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis.
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50
Right.
on the areas that are exposed to
So no
sun.
more trips to
and a
Ibiza.
hat. No more trips to Ibiza. All right?
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Shah.
Yes, thank you very much indeed.
Bye-bye. See you.
Gaynor Pocock, please. All right.
Yeah. Not really.
Well, you wouldn't be here. It's one of those stupid questions, isn't it? Those doctors. I've probably been saying it for the last 20 years.
No, fine, thanks.
OK, I'm Dr Bolam.
Yep.
What can we do for you?
Well, going back last year, I had a growth on my leg. And I feel, or I think, I got another one coming.
OK. So last year, did you have it removed?
Yeah, I did.
And what was it?
Some sort of carcinoma, was it? Something
It
like
was
that?
a cancer, was it?
I think so, yeah.
OK, shall I have a little look?
Yes.
Seeing as do you think it's the same thing, do you?
Well, I can remember this is how it started.
A squamous cell cancer. OK, let's have a look. So the previous one was here.
It's near enough sort of opposite, really.
Right, they did quite a wide excision, didn't
Yeah,
they?
yeah.
Yeah, OK. So tell me about this then. How long's that
This
been going
one's
on?
about a month.
What's it doing? Is it bleeding or anything?
No, not bleeding, but I just know it's there.
You know it's there.
And it's raised more in the last, that's why I've come.
OK, it
started to raise. That's how the other one started.
OK, so it's pretty much the same as the other one, is it?
Yeah.
OK, all right. Yeah, and do you protect yourself from the sun?
Yeah.
OK, all right, I'll refer you back. Was it similar size, the one that was removed?
That's how it started, but by the time I got there, it was like about this, come
I
out
see.
about this big.
OK.
And they didn't ask me for a follow-up or anything, they told me. They just said, if you get anything, just go straight back and get straight back up here.
I'll do the urgent referral, all right, because we like to get rid of those. If it's the same thing, we do like to get rid of those quickly, OK? Yeah. So that means you will get an appointment in the next 14 days. And you understand that, obviously, we have to say this because I have to tick a box. You understand that it's a potential squamous cell cancer again. You understand that?
Yeah.
OK, all right, so this just tells you about the urgent referral scheme, tells you what to do if you don't hear from anybody in a few days' time, all right?
Yeah.
Give that number a ring. OK?
Yeah.
Is that all right?
Yeah, that's fine.
OK?
That's lovely.
Right.
Yeah, I'm just glad I come and got it rolling.
Absolutely, yeah, absolutely. OK.
Yeah, thanks
All
very
right
much
then,
then.
okay.
Thank you.
No worries, bye-bye.
Psoriasis, if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which
That's
is
what I
working.
heard. It would take 5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As hopefully the sun comes out a bit more, and we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I jump on out of that to get rid of it. Well, I'm serious. No, I don't need to use it, but I jump on it if it gets rid of this.
Yeah, it probably would.
Probably would.
It would probably help, yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay, then.
Great, and yeah, I mean, ultimately come back to, the stress that triggered it all off. I mean, is the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You ain't got time.
Yeah.
Life's in the way.
But I'm all right. I know my mum would want me to be strong.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you look at it, but it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've had that.
Right.
But it's very much like...
So, let's just have a look. So, it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's got neither
at all.
worse nor better. It's
No.
just...
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently, or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door, who's our skin guy.
Yeah.
Do you mind if I just quickly see if he's around? I won't be a second. Can I just to really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with, this is Dr. Mackenzie,
Hi.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. Are you not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. Yeah, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, the sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah, that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
That looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
Lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters.
I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating, you know.
Yeah. Okay, and do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days, this front side.
And it's very itchy?
Yeah, but the back one, you know, because I can't see it. So...
The back's where it started off, though?
But I think it's not much now, probably.
Yeah, it's not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
No,
doing
no,
accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else...
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact, it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay. And in there, so it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy,
Yeah.
but it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time I'm having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening, Whether or not there is a fungal component to it, it's difficult to know. But we'll see what happens with this rash over the next 2 weeks. OK.
Thank you very much.
Take care. Take care.
Hello, come in. I'm Dr. Sheikh. Have a seat, please. Right, how can I help?
Yeah, we were here Monday.
Yeah, I did see that,
The
yeah.
rash, it was just on her tummy.
Yeah.
And we were prescribed Piriton.
Yeah.
Told to just do 2 meals twice a day because she's not really supposed to have it yet.
Yeah.
But it's not working, and the rashes, you can see it's all over her face, her arms, legs,
Well,
feet,
just still
and
smiling,
everything.
yeah. Okay.
And he did say if it gets worse to come back, and it's obviously got quite a bit worse.
Shall we have a look? And feeding-wise?
She's been okay with her milk, but not so much actual food.
And having wet nappies, that's normal? Yeah.
Wet nappies.
Okay, why don't you take off all her dress and accept the nappy?
Okay.
Okay.
Yeah.
Yeah, you hold it and I'll have a look at you. Okay. Apply pressure, they disappear and then they come back.
Yeah.
Now you want this toy, this is mine. Yeah? You want to be a doctor? You want to grow up and be a doctor? Okay. Okay. So you can dress her back before she gets too cold.
Yeah.
The rash that she has got doesn't look like an allergic rash. Okay. So you can stop the Piriton actually.
Okay.
Right? So it's not a worrying rash. She's well in herself. She's not got a temperature.
Yeah.
If the rash changes in appearance or if you're worried for any reason, bring her back.
Yeah.
The only other thing I wanted to mention, while I was having a listen to her chest, I did hear a little extra sound in her heart, okay, which is nothing to worry about. Again, we sometimes see this, which we call as an innocent murmur.
Yeah.
Sometimes babies, when they're unwell, they get a murmur and then it kind of, resolves on its own. But I don't want it to be missed. So I'm going to write to the pediatricians to have a look at her.
Okay.
High five?
High five.
Do you feel reassured? Yeah?
Yeah, it's fine.
Okay.
Thank you very much.
Do you want to hold that? Yeah. But don't
eat
tear
it,
it
won't you?
and don't eat it. Yeah. You're welcome.
Thank you very much.
All right, you take care. Bye-bye.
Bye-bye.
Noisy down there today.
Hi, morning. Come and have a seat.
Thank you.
Right, how can I help?
I've seen David Ward about this.
Right.
And he gave me some steroid cream,
Hmm.
but it's done absolutely nothing. It's me ear.
Okay.
It's sort of bubbly, but it's really sore
Okay.
and keeps waking me up. Because I normally sleep this side, but when I turn over, I don't know.
Right.
And I just want to get rid of it.
Okay. How long have you suffered with this?
It's been about 2 months.
Okay. Let's try and see if I can help you for this. So there is a sort of a dry area, and that's tender, is it? When I
Yeah.
touched it. Okay. And then is this tender at all? This bit here? No. Okay. Just check behind your ear.
It's literally just that little bit at the top.
You can get these sort of hard, because you've only got cartilage, very, very thin skin in that area
Yeah.
of the body. Can I compare to the other ear?
You can. Let me get my hair out of the way.
So you can get sort of this development of these sort of horns sometimes.
Don't say that. People
Not that
already
it's gonna get
think I'm
bigger.
a witch.
No. Okay, so what you had was a weak steroid. Do you remember I gave you something called Elicon in the past?
Yeah.
Did you apply any of that on there?
No.
Okay. It's not definitely going to say it would make it disappear, that sort of hard area of skin, but I want to see if it makes a difference. I'm hoping that this is more an inflammation of the skin sort of at this stage. I think it was suggested it could be a wart,
Was it?
like a seborrheic keratosis, but you can get this something called chondrodermatitis. It's a long name, nodularis helicis, where you get this sort of hard bit of skin. In extreme cases, they can cut them out and do things, but we'll try the Elicon once a day. So there's some information there. That's useful, actually, printed out.
Lovely.
All right?
Great.
So if you're not
thank you
happy,
very
come
much.
back and then we'll meet again.
Brilliant.
Yeah, nice to see you.
Thank you.
Take care.
Dr. Shree. Have a good day.
Thank you. Bye. Hi, come through. Yeah, good. Haven't seen you in a while.
I know. How's life?
Not bad. So you got a little one?
Yeah, one of two. She's a twin.
Okay.
She's had patches of eczema.
Yeah.
We got the Cetraben cream
Yeah.
for it, but it's
Yeah.
got really angry and really red.
When did it flare up, do you think?
A couple of days ago, actually.
Okay, we'll have a look. How's the other twin?
Yeah, he's fine. He doesn't have any.
Oh, has she scratched it?
I think, yeah, here, look. See that?
Yeah.
It's like severe.
If it was an adult, you'd almost start to think, is it a psoriasis thing?
Yeah.
But obviously at her age, you can't jump to that conclusion, and it's not very scaly on the surface. So I think it is a dermatitis eczema type thing. So we need to step up to a steroid cream.
She has had it, but not
On-
really red, has she?
Okay.
It's not really red lately, hasn't it?
That's very helpful.
Angry.
So normally the Cetraben helps to calm
Yeah,
it.
well, we just pop it on every now and again.
Is she sleeping at night?
Yeah. Oh, yeah, brilliant. That's the thing. She's not
Okay.
unwell or anything like that.
Fine. Have you noticed anything if she eats, if it aggravates it, or is it just
I've
sort of-
not, to be
no?
honest.
And any pets at home?
Just turtles. Well, we've had them since they've been born.
Yeah.
They're in a tank. So.
And they're quite hyperallergenic. So looking at her history, she's not had a steroid cream in the past.
No.
So I think given how it's sort of in many places, I think I would step up to something like Umivate ointment, which is just a step up from hydrocortisone. I would rather she have something a bit stronger, but use it for a shorter time. So hopefully in the next week, the redness will subside and you can carry on with
we use that
Cetraben.
with Cetraben as well?
Yeah.
Or...
The other thing is if she is scratching and itchy, we could give her also an antihistamine type syrup. If you find it's making no difference with this, then we'll need to review it. Do you want me to give it to you?
Ta. Straight in the mouth.
I know. That's everything goes in the mouth. All right. See you later.
Say bye-bye.
Hope that helps.
Bye-bye. Thank you very much.
All right. Take care. Okay. Bye-bye.
Good, come right in. You've got everybody with you today.
My whole family.
How are you? So this is Azan. Hello, Azan. How are you? I'm Dr. O'Donnell. How can I help?
He went for a tonsils operation in the end of May. Grommets put in his ears, and he had his nose.
Adenoids, yeah.
In his nose.
Yeah.
Ever since then, it was 2 weeks,
Mm.
and he's been sick. He keeps vomiting. Now he's come up with a really bad rash all over his hand. He's swollen
Okay, yeah.
on his face.
Is he vomiting once every day or once every few days? Or?
Once really every day, but
Mm.
for the last couple of days, because he's not eating and he's drinking a little bit here and there. And when I'm trying to feed him, it's just coming out.
Tonsils and adenoids are part of your defense mechanism. So when they're taken away, it does leave you without that protection. The main controversy is, are we removing tonsils and adenoids from children who don't really need that surgery? Are we exposing those children to risk and to harm without any real benefit? Just sit forward. That's right. Good. Just going to take your temperature. That's fine. We'll work out what to do. It's 37.2, so his temperature's okay. Yeah. And when did that rash come?
Do you know, this came this morning, I saw it.
Okay.
It was on his face as well.
Yeah. Just stick out your tongue for me. That's good. Just stand up and we'll have it. Yeah, that's fine. We'll just look in your ears. Yes, you can close your mouth for the moment. That's right. That's good. So grommet is in there. So just open your mouth like a big shark. That's really good. Well done. Now he's going to look at your nose. Good. And just sniff up for me. He is still quite congested. Any cough at all? Open them.
Yeah, the cough.
Big eyes. That's right.
Every night. Cough,
Really?
cough.
Yeah. Okay, so what I think's happening, I think he may be brewing a bacterial infection called scarlet fever. Scarlet fever is a bacterial infection, and it causes a high fever and a red rash, sandpapery skin, and an unusual tongue, which is coated white, and looks a bit like a strawberry. I think it might look a bit like a strawberry in frost, perhaps. One of the interesting features about scarlet fever is that it is the toxin released by the Streptococcus bacterium in the throat, getting into the bloodstream and causing the red rash. And the red rash gives it its name.
But also, I think he may have a localized infection in the operation site that is blocking his nose, which you wouldn't expect.
No.
So what I want to do is I want to give him nose drops, and I want to give him an antibiotic called clarithromycin.
Okay.
I want him to take that for a week, twice a day, morning and night. But I wouldn't be otherwise worried about him.
Oh,
Yeah. There you go. So hopefully this will make you feel a good deal better, Azan.
Yeah, it's lovely.
There you
Thank
go.
you very much. Thank you. Say
Well
bye,
done.
say thank you.
Hopefully
Thanks
he'll
very
be
much.
soon, yeah. Bye, Mum.
Bye. Take care. Thank you. Thank you. Bye.
Lorraine Ward. Hello. It's Dr. Hyder. Come through and have a seat. How are you?
I'm fine. This is I've got this rash here.
Okay.
That's been going on for months.
Okay.
First of all, I thought it was like an allergic reaction to something, but I've been taking antihistamines and using creams and that, and nothing's budging it. And this has been on for about, I'd say about 4 months.
Okay.
On and off.
Itchy?
No, not itchy at all. No.
Do they become red?
They do become red.
All right, can I take a closer look?
Yeah.
Yeah, they look like little, like vesicles, like little tiny round.
What reminded me of chicken pox.
And you've got quite a few dilated blood vessels across the nose.
It's just
there.
really affected my whole face.
Have you noticed that the dilated vessels are a new thing, or have they been there for a while?
No, I've always had them, but they've got worse.
Yeah.
And also underneath my eye as well.
This looks like something called acne rosacea. Have
Okay.
you heard of that at all? Okay.
Right.
So it's not like the acne you get as a teenager, but typically it comes later in life, and it's can be related to flushing. So you feel hot and you can get like a red flushing colour across your nose and cheeks and forehead and
I
chin.
do get very hot,
sometimes.
especially at work.
Okay.
All of a sudden I just get, I mean, obviously I'm coming to that age now, I'm nearly 50.
Okay. And often you can get little spots that look like acne,
Yeah.
but you think it can't be acne because you're not,
Yeah,
you know,
exactly.
the age to
I've
get
never,
acne.
never suffered from acne.
We usually treat it with an antibacterial gel that you apply just on the affected areas for 8 to 12 weeks and see how that goes. And sometimes it can make you more sensitive to the sun. It can be genetic, so is there anyone that you know that's had it, parents
No,
or
not,
anything?
not as far as I'm aware. Is it something that's going to be ongoing or something that will probably clear up with the gel?
I hope that it will clear up with the gel.
Yeah,
but we'll
it's
see.
quite unsightly sometimes.
Okay, so you've been worried about the appearance of it
Yeah,
as
well,
well.
you know, it's embarrassing, isn't it, when people, you know, staring.
So this talks a bit more about it. So at the
Yeah.
start of the leaflet, it talks about what are the symptoms. So frequent flushing, redness, small lumpy red spots, tiny blood vessels visible.
Yeah.
And then it talks about who gets it.
Okay.
Typically appears in your 30s to 60s.
Right.
So that's the leaflet for you to have a look at.
Lovely, thank you very much. Thank you.
Take care then.
All right.
Bye.
How can I help?
You can see by it's just his rash.
Yeah.
It's completely covered all over his body.
Mm-hmm.
He's been taking Piriton.
Mm-hmm.
He keeps sticking it up. I don't think he likes it.
Is there any discomfort with it?
No, it's not itchy.
No? Okay, so he's quite comfortable in himself?
Yeah, he seems all right, yeah. I'm just feeling itchy looking at him, that's all.
Completely.
Yeah.
And is there anything that he has that makes this worse?
It's only because he started crawling, whether he's getting around in carpet or something, I'm not sure.
Mm. So can you just undo his dungarees so we can have a look? Oh, I'm sorry. Okay. And you've not changed your washing powder or soap or anything like that recently? So, let's lift you up. Mum, can you just grab his back? Just have a look at that. Okay. Okay. Normally what we'd use is a mild steroid cream just to settle it down, but it's not really going to help us find out the cause of it. So considering he's so young, I think it'd be worth getting the paediatricians to have a look at him to see what they think, to see if they want to carry out any sort of testing. Because he's been weaning onto solids. Is this a food-related allergy? Is it something else?
So just carry on taking the Piriton.
Carry on taking the Piriton, that's not going to do him any harm, and hopefully eventually it will start to take effect. Anything that you think's making it worse, obviously just try and avoid and keep a note of, okay?
She reckons it's me. I don't think it's allergic to me.
Well, I don't think it would take 6 months for it to show.
Yes, that's what I thought. Okay then.
Okay.
All right, thank you, doctor.
All right, no problem.
Thank you so much.
Don't forget it's dummy.
Oh, yeah.
Okay.
This is my girlfriend.
Nice to meet you both. How can I help?
Benzoyl peroxide.
Okay.
I was wondering if I can get some sort of benzoyl peroxide.
Yeah.
On my face.
Yeah, to get some more, yeah. Okay.
Duo or something. We was talking about Roaccutane.
Yeah.
I think that was Roaccutane, but he was on about saying I need to get referred to the hospital or something for that.
Roaccutane is actually a brand name for the drug isotretinoin, and we use this medication in cases of moderate to severe acne, but more importantly in patients who we think are at risk perhaps of developing scarring as a result of their acne. So your acne, is it mainly just in your face, or does it affect your back and chest?
I don't know.
It's mostly the shoulders.
Yeah, my shoulders.
Shoulders and then face, okay. So how long have you been having treatment for your acne for?
I mean, I've had it for about 5 years now.
5 years,
I only
okay.
started getting treatment about 2 years ago.
Okay, so what we do next really depends on you. We can keep going with the cream and the tablets if you think that it's making visible differences for you.
I mean, at the moment, I'm using tea tree oil.
Okay.
Just like putting a bit of that on my face just before I go to bed. It burns and stuff like that. But like, I get up in the morning, I have felt a significant difference between
that's
smoothness
fine.
and stuff like that.
I would say, looking at your skin, I'd classify this as moderate to perhaps quite severe acne in the way that it's presented on the face. And certainly my recommendation anyway would be that if you've tried for 2 years and it's still at this point, I think certainly a referral to a skin specialist and consideration of that specialist medication, Roaccutane, is certainly worth considering.
Yeah.
Unless you have some objections to that, unless you know.
That's fine,
Yeah. Okay. When the dermatologist sees you, he will go through some of the risks and benefits of this medication, the Roaccutane, because it's not entirely straightforward. There are some side effects that he'll probably go through with you.
My uncle's partner had acne and she had Roaccutane and stuff like that.
So you kind of...
She was saying that it burns and stuff like that.
Yeah.
It made a hell of a difference.
Isotretinoin does require a lot of monitoring. It has been shown in some cases that the medication can have an effect on your mood and behaviour, and there have been some reports of people perhaps having thoughts of self-harm or even suicide with this medication. And so therefore it's usually initiated by a skin specialist or dermatologist. Okay, so what I'll do, I'll do a referral and we'll give you some Epiduo and more of the tablets today. There you go, okay. You'll hear from dermatology in the post with the appointment details.
Lovely.
All right,
cheers.
Take care.
So something for his skin, is it?
Yes, please. That's the one.
So mometazone?
Yeah,
that's a really strong steroid cream.
Yes, sir.
This is not something that we would ever put on repeat for a child. Importantly, what we need to assess is how is his eczema?
His skin is fine. If you can have a look over here, everything is...
So you can see there's some redness just here, can't you? Kind of classical eczema, dry skin. Yeah. How about his arms?
Arms? It's here.
Oh, wow. OK. How about legs? I like your trainers. OK. So that looks quite sore, doesn't it? You can see he's been scratching at it. OK. What's his bath time routine like?
His bath time routine is like two or three times a day, a week.
OK, so you're not having bath every day. We know that things like soaps, shower gels, bubble baths, they all make the skin dry. He doesn't use any of those. That's perfect. What we could give you is a tub of cream, and when he is having a bath or a shower, you can rub that in all over the body and then just wash it off. Twice a day is good. It would be even better if it was 3 times or 4 times a day. Here's the crucial bit. Eczema is a dry skin condition. If you chuck moisture at dry skin, it's going to be perfect. It will work. That means then you don't need the steroids. Because we are really reluctant as doctors and clinicians to give steroids, especially in a child as young as Nirmit, who his skin is not going to be like your skin, okay? It's going to be thinner. And steroid side effects are that they make the skin even thinner. So these should be reserved only to use when there are flare-ups of eczema. I'm really concerned about how strong that is.
Okay, no worries.
And at the moment, actually, his skin's not that bad.
Okay.
It doesn't need the really strong steroid. So I'm going to keep those 3 things on repeat. So Cetraben will be on repeat, soap substitute tub on repeat, and an antihistamine to drink once a day. And that's his regular treatment. That's the time to come and see us, and we assess the need for steroids.
That's fine.
All right? And it looks like we can send this prescription electronically just to the pharmacy. I'll do that right away.
Thank you very much.
You're welcome. Nice to meet you too.
Come on,
Take care.
Say bye.
Bye-bye, young man.
Bye-bye. Have a nice evening.
Be good.
Enjoy.
Take care, you too.
I'm trying everything to try and get that off, but no matter how much I get off, it keeps coming back constantly.
They're very dry, aren't they? Why are your hands this colour?
I just put the yellow powder a little bit.
What, turmeric?
Yeah.
You've put turmeric on your hands?
Yeah.
And I have noticed recently that she scratches herself a lot,
Really?
to the point where she makes herself bleed.
Oh, bless her.
If I pull my head over,
Yeah.
shake it,
Yeah.
it's a snowfall.
So almost dandruff type.
Yeah, but
Lots of
more
flaky, dry
yeah.
skin.
There's no bus anymore. I had to get a taxi here, cut our bus out totally. There is no transport whatsoever.
When did that happen?
About 3 weeks ago, when they first did the new bus routes.
Yeah.
No bus whatsoever. How can you do that? Not be able to get to... Anyhow, never mind, you're busy. Look, while I came, I've had 3 lots of antibiotics. Now, because most of them were done over the phone, obviously they couldn't see it. But the last time I saw a doctor, he wasn't a skin doctor like you. Now, it's just like going to the dentist, it's cleared up now. But I just want to show you where it was. I keep getting this cellulitis, which probably happens with the scratching and the cracks in my feet. And I've had 3 lots of antibiotics, which I didn't like taking. First of all, see, I get it here. That's where I always get it. Then it spread. I had it across here, all round there. But the worst thing was here. This went all like orange peel, went mauve, and it was puckered. Do you know what I mean? All puckered in here.
Yeah.
And it was like when I walked, like elastic band round my leg, shooting pains up my legs, and the pain was excruciating.
And what was it, diarrhea for how long, sorry? 3 days. Right, okay, I'll put that down for you. Okay? Thank you, bye. Oh, how do you spell diarrhea? Dio.
You're asking the wrong person.
It's such a hard word. I'm gonna Google it. Oh, I've definitely spelled that wrong.
Do you ever think that? It's a good thing you've come today, actually, because there has been sort of another product that's come into use, which is for psoriasis.
The trouble is, Dr. Shri, I can put up with the hard skin, I can put up with the cracking, everything. It's the itching. It's unbearable. I can't sleep at night. I wake up 3 or 4 in the morning with the itching. It's so bad. What is it, though? A cream or a...
It's kind of like a mousse.
Literally, I could scratch until I ripped my skin.
It's always been one of the things that I think has most irritated you about this, isn't it? So I will...
My God, they're running late out there. I think it's only you, isn't it? See, you shouldn't be so popular.
No, it's not that. I think we're
You're
closing
too
in
nice.
on
I'm telling you, you're too nice. Because where most doctors, they sort of just chuck you out, you know, and you chat. Oh,
That's
yeah.
not what I've seen.
Yeah, some of them do, I can assure you.
There are times when we do have to run late because the problems just cannot be done within 10 minutes. But there are also occasions where, you know the struggles, like, for example, who've had to come in all sorts of ways to get here because your bus routes changed, means that, how can I
It's
say...
non-existent. It's disgusting. How you can leave a whole community of people stranded, unable to get to the chemist or the doctors or public transport.
So that's the new foam. You have to physically rub it in.
Oh, I'll try anything.
Might be
Let's face
better.
it, I've tried everything else. I didn't like taking all those antibiotics.
This obviously is not a tablet, so hopefully you won't have any problems. Okay, good.
Yep.
Nice to see you. Take care.
Lovely seeing you as always.
All right.
Bye-bye.
Have a good day. Bye-bye.
Come and take a seat on Mum's lap, hey? That might be better. What's the problem?
I had a chicken pox.
Yep.
Probably infected her.
Yep.
So I found some spots.
Let's have a look, shall we?
Bubbly one.
When did you have it? That's terrible having it as an adult.
Oh,
How were you?
yeah, tell me. I'm better,
Yeah.
but it's still, you know, it's drying out so slowly. And my ego, you know.
You didn't have it as a child?
No.
No?
No, I could avoid it for 40 years.
How is she in herself?
She's fine. She doesn't have fever, and didn't have.
Yeah, it is. There's one there.
Yeah, and on the back.
There's one there. There's
Yeah,
one there. That little blistery thing on the top there. Yeah. When do they start today? Or?
I found 2 spots yesterday.
Yeah. So yes, I think it's chickenpox. So the same thing that you probably heard about for yourself. Okay. So it's it's a virus in any case. So you can feel unwell with it. Adults normally more so than kids. And in fact, with adults, you can get some really nasty, sort of terrible headaches that come with it, and often a chest complaint as well. Whereas kids often don't have that, so they tend to have a milder form. Some of them will get a few spots, and that's it. And others will be covered in spots.
Yes.
Okay. You can try whatever you want to stop the itch. It'll be itchy. They'll probably scratch them. Okay.
Yeah.
You can use a bit of calamine lotion or something just to dab on it. It's not a miracle. Okay. So it will still probably cause some problems. The times that we worry about it is if some of them become infected on top of it. Okay. So if you've got a scabby thing which becomes really pussy and really red and the red's spreading, then we would need to see her because that's probably another bug that's just got on top of that. Or if she starts developing on the edges of her eyelids, we will sometimes use an eye ointment just to protect the eyes from that, okay? But if she gets any temperatures and fevers, then just a bit of Calpol. Make sure she keeps up her fluids. See how you do.
I know. All right. Thank you very much.
Okay, good luck.
Yeah, fingers crossed. Thank you so much. Okay,
That's fine.
thank you.
And what's brought you here today?
So she has, I can only describe it as a rash on the back of her neck.
Okay.
Which is a lot more fierce and flared than any that we've had before.
Right, okay.
But we don't know what they are, and we can't work out why she keeps getting them.
Okay, and has she been well in herself?
She's well in any other aspect.
Right, okay.
That's that might be our animals, our 2 cats.
You got 2 cats, have you? Okay.
Look at them.
And do they get regularly treated?
Yeah, this is the thing. At one point, I was getting to the point where I was hoovering mattresses and...
And have you actually treated the house as well?
Yeah, I've sprayed the house.
Let's have a little look at your neck.
Stand up then, sweet. So that's the worst I've ever seen them.
How do you sleep? Are you in a duvet?
Duvet.
And do you have
you wrap yourself up in those little woolen blanket things.
A night dress?
No, she's been sleeping in her vest and underwear.
Vest and
recently.
underwear, okay. See, I'd say they look like bites.
Okay. Any idea from what?
Could be flea bites. That's what it looks like to me.
Because I've literally stripped everything. I pulled everything out of her room and hoovered the lot, sprayed the lot, and then the cats are defleed every 4 to 6 weeks.
The only way we can do it is, again, suggest treating the house and maybe this blanket as well, really.
Is there anything that I can do to make that go down?
Stop it itching, she could take an antihistamine.
OK, well, we've got that at home, so that's all right. Right, we're stripping your bed, we're boiler washing everything, we're spraying the hell out of your room. Everything that lives in your room is dead by the end of it. See, cats, bad idea. Bloody things.
Thank you.
Hello. Are you Phoebe?
Yeah.
Very good. Let's give you a chair, Phoebe. Are you going to sit there?
There you go. Ready?
And who's this, Phoebe?
Nancy.
Nancy.
I got some spots.
Do you want to show the doctor where they are?
They're
Actually-
on my belly.
Well, wait a minute. I think I need to ask Mummy a few questions first, and then I'll have a look at your spots in a moment. All right? How long has she had the spots for?
About 4.5 months. And they're only behind the legs here and a couple on the belly, and they look like little skin tags.
She's obviously reasonably well.
She's absolutely
completely
fine. I think she's got a little bit of eczema as well on the back of her legs.
Have you had eczema before?
Never, no. I think the hot weather's brought it out.
OK, we're going to have a look at your spots now, Phoebe. Will you show me your belly first? She's only got one.
She's got a couple on this
Oh,
side.
yes, I
You
see.
can see where she's and they've
Yes.
cleared.
No,
but it's
there's
not-
one. Look, that's a perfect one there.
Yeah.
The other thing is, Mummy wants me to look at your leg. Do you mind standing on the chair? If you just keep a hold on her. Yeah, a little bit. The name for that is molluscum.
Yeah, that's what I couldn't remember.
I'll print off the sheet for you. So it is a virus. And you don't want to do anything with them. Although they all go in the end, they can linger for quite a while.
Yeah, it just feels like
Common, harmless, just try to ignore it.
But is that definitely eczema on the back of her legs there?
I think you'd call that eczema, but I mean, she may have got some spots and picked them and they've got a bit irritated. Let me give you some treatment.
Yeah.
Mild steroid, just for where it's bad. When you've cleared it up, leave it off and wait and watch what's happened. Okay. And if it then comes back, we would adopt a slightly different approach.
Yeah.
Here's some stuff on molluscum. I mean, she's got it very mild. Quite likely she'll get more spots. If she picks them, she'll tend to infect herself, but you can't stop her picking them. So.
Thank you.
Right, Phoebe, are you playing a game?
I need his gloves.
Phoebe, you may have that glove. Special present.
Wow, doctor's glove. Thank you very much.
Pleasure. No, that's Mummy's job.
Yeah.
Take the glove and take the book.
What do you say to the doctor, Phoebe? No! Can I?
Very good.
Right, you're going to take your glove?
It's lovely to see you. Bye-bye. Bye-bye.
See his next patient. Thank you.
Debbie Kroll. Hello there. Come on in. Have a seat. I'm Dr. Graham.
Hello. So last time I think I had a water infection.
Did I?
Yeah. I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know. I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, OK.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
OK.
No, so I don't...
Should we just take your temperature
Okay.
first? That's fine. 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
OK.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah. I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
OK,
yeah.
let's have a look. I'll just put some gloves on.
OK.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? OK.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch
so
it.
I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And
no.
hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, OK?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely.
And good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye bye now.
Thank you. Bye bye.
I have got, I think it's a mole, but it's been a bit itchy.
We call it a seborrheic keratosis, and it's
Right.
just a little warty stuck-on thing.
Yeah.
It's almost like there's a crust over the top of it, isn't there?
That has been getting a little bit darker and bigger. Not that it's that big.
It's kind of a little bit of a dry, scaly one. And it's just it's quite soft and loose.
Yeah, so that's more reassuring, actually.
Well, the good thing about this one is that it's a little fleshy one that sticks up and you can move it around.
That's what the doctor said last time.
Kay Frankson, please.
Hello.
Good morning. I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules. I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new?
It's new and it's...
But you don't, because if you have many moles...
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
Ah, at this point I have to do something which is fraught with risk.
Oh, hello.
Is it this thing here?
Yes.
Okay,
Well, there's a cysty thing as well.
Have you seen? Have you looked at them?
I can't see them
So
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, they've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, you're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
You know, check it again in a few months' time.
It was quite hard to take, actually.
Oh, I'm not suggesting you. Surely you can get somebody else to take it, can't you?
Could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal.
Okay.
All right.
All right. So that's it then.
Yeah. And do come back if you're worried. You know, whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It will take a bit longer, but
all right.
It's not a big deal at all.
Okay. Well, thank you very much for reassuring me.
Good.
And have a nice day, as they say.
Bye-bye.
Bye-bye.
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long has it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it. And, caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take...
you were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
I had such a nice bum before as well. But
it's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement in my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm
yeah.
just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So, I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
That's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.